Well, hello guys, my name is Larry and let me welcome you to the channel today. We are going to go over a subject that probably a lot of you have had a question, as I did when I started filing my claim with the VA. That is, how do you get your records to submit these with your claim so that you can actually, I guess you should call it, verify the claim. Either way you look at it, you're going to have a Nexus letter, and that is something you cannot write. You have to have somebody that's either a doctor, a lawyer, a doctor, a PA, a physician's assistant, a nurse, a psychologist, psychiatrist, not so much a lawyer, but I mean they could write it, but a doctor would have to sign off on it and verify the information that you're claiming is wrong with you. So this topic is how to get copies of your records to give to that person that's going to write that Nexus letter for you. Now, chances of getting the VA clinic to actually write you a Nexus letter is nearly impossible. They would be contradicting what they're doing in that scenario. So, you want to have somebody treating you write a Nexus letter at the VA clinic. They just don't do that. Now, there will be a VSO officer, a veteran service officer, at one of the clinics, and I'm going to put a video out on that one. That one was a pretty touchy subject right there. There's really no means of communicating with them once you filed your claim with them outside of scheduling an appointment, and we'll cover that later on. I don't want to get into that. But this is how to get your records that you're going to need to give to that individual, that doctor, an outside doctor outside of the VA clinic, or a physician's assistant, or whoever you feel comfortable with that can write a good Nexus letter. Writing a Nexus letter is very important. I mean, that will seal your claim right there, especially if you have something that's happened to you in the military and now you're filing for 15 years later. Maybe you've got a claim already open and you're getting a small disability of 10%, but you're trying to get an increase. That Nexus letter, you pretty much just have to have it. Now, you'll go out here on YouTube and you'll find some of these guys that are saying, oh, we can write you a Nexus letter, we can help you with your claim, but there's no guarantee. And the few that I have reached out to, with the exception of one at this point, they just really give you one consultation and they'll call you. You can't call them. They won't give you a number to reach back out to them to get that issue resolved. They will call you and you won't be able to call them. So it's like, okay, do I give them this $2,000, this $3,000, this $4,000, and as much as $12,000 to help you file your claim? You can file your claim yourself. A VSO can file your claim within 10 to 15 minutes of the visit, but you still got to have the Nexus letter. So again, enough rambling. To get the information you need for your Nexus letter, there's several ways to get your medical document, and one of them is the National Archives. However, that could take forever to get. And you know as well as I do that it takes forever for the VA to initiate your claim and go through the claims process before you get your first check. So time is of essence. Now, the way I like to do it and the way I'm going to be doing it and showing you in my videos is we're going to go to VA.gov. That is a site that any veteran can sign into. And not only is it a good site that you really need to sign into and sign up with, but there's other things you can do in there. And several of them are, you can make your appointments, you can schedule and manage your appointments, you can see your upcoming VA appointments, you can find VA locations, you can refill your VA prescriptions, you can even track prescription delivery, medications and allergies. You can check that. These are all things that are right at your fingertips. And you can also file a claim for travel reimbursement. You can pay your copay bills, which, if you got medications you have to pay for, you can go there and pay that. You've got a messaging inbox. You can compose a message and send to your healthcare team. You can manage your folders in there. Health records, you can download medical records called the blue button. We'll get into that in just a minute. I'll try to turn the camera around where you can see what I am seeing. I'm not sure that the camera's going to get you a good shot of the screen, but hopefully you'll get some kind of thought as to what it might look like. And most important, when you get in there, you can view your health history. That is something that you're going to need to do. That way you can say, okay, I've had this claim back in the military in 1995. I'm getting a 10% disability beginning in 2001 for, let's say, tinnitus. But you also have hearing loss, but the hearing loss you're getting 0% for. You're getting 10% for tinnitus, but you want to increase the claim because it's been 25, 30 years and you're still having problems more so now than ever with your hearing. So this will help you get a lot of that information you're needing to compare from back then to now. Now, I noticed in my records that it didn't really show anything prior to 2001. So thank God I did have my original records of when I got out of the Navy in 1981. So I've got the hard copies there that I can make copies of and send to whoever's going to write my Nexus letter. And then I'll be able to download the records that's currently in there from 2001 to today. And it documents every visit that I've had at the VA clinic, what they've seen me for, the doctor's name, the time, what they did to fix it, the medications they put you on. It has a ton of information that's very, very helpful. Now, you can also get your medical supplies through there. Order hearing aid batteries and accessories, or order CPAP supplies, or order prosthetic socks. Now, that's not it. There's a lot more information on there. You know, a lot about more resources and support, the PACT Act and your benefits. You can check your mental health, Veterans Health Library, Healthy Living Centers. There's just a whole lot. So give me a moment. Let me try to turn this camera around and put it on the screen so you can see what I'm seeing, and then we'll continue with the video. All right, I was able to set my camera up where you can actually see what I'm seeing from the screen side. Now, this is not a screenshot with some computer program. I'm actually trying to get this shot with my camera, and it may not be perfect, but hopefully it'll be enough for you to see. Now, if you look at the top of the page, you're going to see VA benefits and health care, about VA, find locations, my VA, and my health vet. Right now, currently, they will be working on my health vet, which that's been down since yesterday, but you can still do a lot of things inside there. It tells you when it'll end Friday, December the 1st at 1 o'clock a.m. This website is very, very helpful, especially if you're trying to get information. You don't even have to make a phone call. A lot of times you can go right into this website and get exactly what you need. Now, if you look here, this is some of the things I called out to you a while ago. I'll kind of highlight them and run down them. Messages, appointments. You can schedule, manage your appointments. Upcoming VA appointments, let you know when you got them. Now, this is my personal information, private information. I shouldn't be giving it out. What right now, see? We take your privacy very seriously. Didn't take any action on VA.gov for 30 minutes, so we signed you out in the site to protect your personal information. So now I'm going to need to sign back in, and I'm going to kill the camera to sign back in because nobody needs to see my information. Okay, this is where you go to when you want to sign in. Login.gov, ID me, DS Login, or My Health Vet. Now, you can create your own account, and you're going to have to create an account in order to use this system. Now, it also has a section that says having trouble signing in. Myself, I like to use the ID me. It's something that I remember, and I've been using it for quite some time now. So we'll click on that. It's authenticating the site. Now, when you first sign in, which I just did, it'll show my name up here at the top, and then you'll be able, the first thing that pops up is the PACT Act and your VA benefits. And then you can go down and explore VA benefits and health care. You've got health care, careers and employment, life insurance, service member benefits, and it goes on disability. File a claim for disability compensation for conditions related to your military service and manage your benefits over time. You can apply for monthly payments for wartime veterans and survivors with limited or no income who meet certain age and disability requirements. You got burials and memorials, family members' benefits, education and training, housing assistance records. There you go. That's an important one. VA department information. And to get all this, like I said, you're definitely going to need to create an account. And there's more. There's a lot of stuff down at the bottom of it. Veterans programs and services, more VA resources. You can go down the list, see if any of those pertain to you. You can get your VA updates. They also have them out there on YouTube, Flickr, Twitter, Instagram, and Facebook. All VA social media. And if you're in a crisis and you need to talk to someone, there's an important link right there. Veterans Crisis Line. And then, of course, you got the number. Contact them at. And you can find a VA location if you have any medical issues and you need to visit somebody. Now, if you want to look at your appointments, just go into your appointment section there, and you'll see the times you're going to have your appointments, like December 23rd, January 24th, February. Tells you where you're going, community care. And if you want to see the details, you'll pop that up over there, but I'm not going to do it for privacy information. But this is an easy way to keep up with your appointments. Now, if you have a claim or an appeal open, it'll be down in the section here also. I have a claim that I just recently opened that's going to be tied in back to 1981 when I was in the United States Navy. So I can't really click on that. I don't want to show you that for privacy reasons. But when you get in there, there's a section that you can go to that tells you what process that claim is in or that appeal is in at the time. So that information can be found right here on this website as well. Now, let's say you're trying to get your medical records. The simplest way is you go right there to this area right here. It's called Download Medical Record. Now, you'll click on that. Like I said, you'll click on that, and then it'll take you to this page. And at the top left-hand side of this page, it's going to have your personal information up there. I would like to show you that, but I can't. It's my private information. When you get there, there are several buttons you can click on. As you see here, you have VA Blue Button Report, VA Health Summary, VA Medical Images and Report, and Electronic Record Sharing option. Now you can opt out of this bottom one here. However, if you're using an outside physician or doctor or medical clinic that would really need access to your records, if you opt out of that, they would not be able to see your prior history and would not probably be able to diagnose you correctly. So that information would help them. That's important. So you want to make sure that that is myself. I want to opt in so I can share that information with any outside doctors that I might see. Now, if you want to go into the VA Blue Button Report, you just click this right here and it'll open up a new page. Now, this is pretty interesting here. Say, for instance, you only want to look back at your stuff for 3 months. You'll click that button right there, and then you'll come down here and change these dates, unless they're already set. So we're at September the 1st of 2023 to December the 1st of 2023. And then you go down here and you can select specific types of information, future VA appointments, past VA appointments limited to the past 2 years, or you want all the above. Now, if you really want to see everything that's going on, just go right here, click the all types of information, and you'll see that it will download just about everything that's in your records. Now, let's say you just want to go in and check, just your medications. I'm going to go to that button right there. I want to go to VA medication history. And if that's all you want, you go down to the bottom of the page and you submit it. Once you submit that, then it's going to take you to another page. And I have to block out my personal information here, but it'll ask you to view it or download PDF. And let's say you want to view it, you just click this link here, or if you want to see the secondary, which is a smaller file, you can view it as well. And then it'll take you to another page that brings up all those medications that you requested to view. Now, in a section where you get into your personal health, there is a category that you can click on once you do the download and you open it up. This is where it's going to go to. Now, I'm going to have to be able to show you only limited amount of what can be done in this area because of all the personal information that it will show on myself or whatever person I'm bringing up on the screen currently at the time. So this is something you'll have to play around with, experiment, go in once you sign up. It doesn't cost you nothing to create the account, and it really helps you stay on top of many different things instead of trying to call the VA clinic and sometimes being put on hold for 1 to 2 hours and waiting on a call back. A lot of this information will be right here. You start at the top, patient and contact information, your healthcare providers, your insurance providers, advanced directives, your allergies, your encounters, your functional status, your medications, immunizations, procedures, plan of care, treatments, your problems, results, social history, vital signs, consultation notes, history and physical, discharge summaries, radiology studies, pathology studies, and procedure notes. It is a ton of information here, folks. I had no idea that there was so much stuff out here that we could research on our own. I've never really been told straight from the VA clinic this stuff was possible to get access to. As a veteran, I did not know that we had this much access to all this information with the touch of a mouse button. Now, I didn't know about any of this stuff till probably the last year or so, year and a half. And I really didn't go in depth and dig it up and look in depth like I did the last couple of days. A lot of this information will help you tremendously if you are trying to file a claim or get a increase in your disability benefits, or you're trying to file secondaries. A lot of these companies out there, they want to charge you by the page, by the hour, and you can do all your homework right here and find you that doctor that you need that will write that Nexus letter. But I've stumbled upon this and I've been struggling for the last 2 weeks to find a doctor to write a Nexus letter. No doctor wants to take his time to write you a Nexus letter and charge you $600, $700, $800 for it. And without that, probably the VA's most likely going to deny your claim. I talked to so many veterans and different organizations, and it's kind of like we're shut out in the cold. We've got the issues, we've got it documented, it's in our records, and we're just praying to God we can find a way to connect it, to that claim So the VA says, okay, we'll take care of you because we see that it is documented in your VA medical records. But they want you to go out there and spend all this money to get the information that I think is a roadblock for most veterans. And then you got these companies out there, and I'm not going to call any names, but if you go to YouTube, you'll see these companies put out these videos. Oh man, these disabled veterans are putting out videos. Everybody's putting out videos, just like I'm doing today, but I'm not trying to suck you in and get $4,000 to $10,000 of your money. To help you file your claim and get it accomplished where you get your disability that you've worked and struggled to get and you deserve as a damn veteran. I'm going to put a plug out there to one doctor, and I am going to find out how to use him. It's called Ellis Clinic in Oklahoma. He's an old retired Army guy, and I like his attitude. He gets point to the blank. He tells you what can be done, how it can be done, what it's going to take to get it done. Tells you what he's going to charge you. And I'm pretty confident in the work that he would provide for me, being he has so much experience and so much knowledge. Now, as far as any of these other companies, you do your own homework, but they're just out to make a big buck on you. Some of them are claiming to be veterans. Oh, I've been in the Army, I've been in the Navy, I've been in the Marines, and I can show you how to file your claim. Yeah, it's all about making big bucks off of you. Some of them even want to take a percent of your claim for the whole damn year. So if you get $12,000 and they take a fourth of that, look what they're getting for the whole year. From what I'm finding, the average Nexus letter, after doing a whole week of research, it's going to cost me anywhere from $600 to $2,000. Yeah, that's a chunk of change. That's a nice big pile of change that I wish I could keep myself. But I think that I'm going to have to spend that because you got to have that link tied between the... Well, I had an interruption there. Now I need to get on track. But no, like I said, it's just so many vultures out there, man, that are using this Nexus letter to profit their pocketbooks in general. It's, man, guys, I wish I had the knowledge and the skills to do all this for you. I'd jump out there and help you out with Nexus letters. I'd let you get your documents, your medical records like you need. But I'm not a physician. I mean, I'm a veteran trying to help a veteran. And that's what you're going to see from a lot of these guys out there. I'm a veteran trying to help a veteran. But if you look in the bottom of the damn page, it's about, well, contact us at this email address and we will set up an appointment. And then they'll call you back only one time, give you a 15-minute consultation, and then they want you to send all your medical records in. And next thing you know, they're going to tell you, well, it's going to cost you $6,500 for us to complete this because you got a long list of records. And you have to pay that before we give you the Nexus letter. And you spent $6,500 and there's no guarantee your claim's even going to be approved. So there needs to be a more fair system for the veterans that are claiming. This is crazy, guys. So don't fall for that trick out there that, well, we'll write you a Nexus letter for $2,000. We'll guarantee your claim's going to get paid. That ain't how it's going to work, I can tell you. And I haven't had my claim has been filed, but it hasn't been approved yet. That could take 6 months to a year, maybe even longer. But my point is, do your homework. This VA.gov site will help you get all the medical that you need, but it may not give you your prior history while you was in the military. Now, I was smart enough to save my records from 1981 till the time I started receiving VA care in 2001. So I have the hard copies, just like I stated in the early part of the video. However, I'm going to have to make copies of those, send them to whatever doctor I see fit that can write me a proper and correct and a good Nexus letter, and then I will submit that with my claim, which has already been filed, and it should tie everything in legitimately, and then we're going to see what the VA is going to do when it goes through the claims process, and what increase I'm going to get from the 10% disability that I currently have since 1981. Well, guys, I know I rambled on a lot, but I do hope that you take some of this information, especially about writing these Nexus letters. They are important, but find you an alternative way. Don't go after these vultures out there on YouTube that are dressed up in nice suits and say, I'm a veteran and I'm here to help you. Most of them, yeah, they're helping their pocketbooks. They're not out to help you. And again, I wish I could find a way to help us veterans out, just like I'm wishing somebody could find a way to help me out. But it's all about greed, selfishness, and the greenback dollar right now with some of these people out there on YouTube and claiming to help veterans. So I ask that you hit the thumbs up, like, and subscribe. I'm going to try to put out more videos, especially that are what's related to this claim that I'm processing, how long it's taking. If I find a good person that's going to write this Nexus letter for me after I send them the medical documents, I will put a link in the post down below. I'm not saying it's going to be for free, but I don't mind paying $600 to $1,000, $1,500 in that range, as long as I know that it's going to be a sufficient Nexus letter that will do my case good and not some gimmick that somebody's just making a bunch of dollars, bunch of money off of. Thumbs up, like, and subscribe. See you in my next video. God bless you.